Aloha, my name is Brady Barrows and I wrote the book Rosacea 101, and it includes the rosacea diet. It's a 373-page book, very comprehensive, about rosacea. And I'd like to talk to you today about Rosacea Mimics. Now, why is that important? Because there are skin diseases that look like rosacea. The classic one is, of course, acne. Acne vulgaris is another skin disease that looks like rosacea. Now, why is it that we need to discuss this? Because there's not only just that disease, but I have a total list of 54 Rosacea Mimics in my appendix, page B. It's in the back of my book, appendix B. In chapter 2, Rosacea Mimics, I discuss the 4 main Rosacea mimics that look exactly like rosacea, and how can you tell the difference? Well, you can't. The only way you can do this is to go to a physician. A physician is qualified in the art of diagnosis. A dermatologist trained in diagnosing rosacea and its variants and the other mimics can determine what skin disease you have in your face. So self-diagnosis is not a good idea. You really need to go to a physician. The 4 main skin diseases that look like rosacea, the Rosacea Mimics, are perioral dermatitis, seborrheic dermatitis, keratosis pilaris, and pityrosporum folliculitis. Those 4 look exactly like rosacea. And if you saw pictures of these different skin conditions, you'd all say, well, it looks like rosacea. Why is this such a problem? Well, you could have rosacea, but the other thing is you could have one of these other skin conditions. At the same time, you can have, say, both. It's very common for rosaceas to have seborrheic dermatitis, it's SD for short, and rosacea at the same time. Or, for instance, you may have acne vulgaris and rosacea at the same time. The other thing is you could be misdiagnosed. A physician may have given you a diagnosis of rosacea, and then later you discover that you have SD. So it's very important that you don't self-diagnose, that you go to a competent dermatologist to determine what's on your face. And this book, Rosacea 101, is for rosacea newbies, and you should read this book because it'll help you in finding out how you can control your rosacea. I've covered all sorts of ways, conventional and alternative treatments, and I'm sure that this book will be very helpful to you, and I hope that this discussion will prompt you to get a diagnosis of rosacea from your physician.